And welcome everybody to another brand new Nothing Like a Good Book, where we go right into depth with upcoming authors. And this one, well, it's a little different, okay? We're talking about achieving longevity without happiness. Well, guess what? That's meaningless. Who says that? Albert Chan, MD. In fact, happiness engenders longevity. Longevity without happiness is meaningless, and this is what I'm going to be speaking about with Dr. P. Albert Chan. He's a preventive cardiologist, an author of today's book of Everything About Happy Longevity. Evidence-based medicine, East meets West, and Dr. Chan's comprehensive guide to a long and healthy life. And we're going to discuss the how-tos, the do's and the don'ts, while also debunking common myths about health. Now, the book is what it's about, and that's what we're here for. And the book is actually titled Everything About Happy Longevity, but as evidence-based medicine, right? East meets West. So without further ado, welcome, Dr. Chan. How are you doing?
Oh, good. Thank you for inviting me.
You're most welcome. Interesting book. I mean, rule number one, as you say, longevity is not to die young.
Correct.
Okay, so this book has a plethora of suggestions and tips to achieve a healthy lifestyle that will ensure longevity. And you do teach about also the 5 devils of health: heart disease, stroke, cancer, diabetes, and dementia. They're the big 5, offering methods to prevent and reverse. These are major health risks, and the book also covers the 5 F's for happy longevity, which we'll get into: fitness, family, fortune, fame, and fun. Okay, so according to you, all the recommendations in this book are based on many years of research and practicing medicine experience and backed up by current evidence-based medicine. So it's not just, willy-nilly, is it, Doc?
Correct, yeah.
Okay, so you talk about your rule number 1, rule of longevity. What is the number 1 rule of longevity?
Okay, rule number 1 of longevity, as I said, do not die young. It sounds like pretty obvious, but actually a lot of people didn't do it. They don't know about the risks of major diseases, and they don't know how to, or they will do something to prevent them. So as I said, the 5 devils are the heart disease, stroke, cancer, dementia, and metabolic disease, which including diabetes, prediabetes, and obesity. Now, if these 5 together probably kill more than 80% of Americans.
Wow.
But actually, most of them, almost 90% of them can be prevented. But you have to do it early. More than that, you have to know your risk, because everybody has a different kind of risk of different kind of disease. So the first thing you need to do, you do need to know your risk currently and try to prevent or reverse the risk factors. So that is the key of the book.
Okay. Well, if I was to ask you, because you rattled off heart diseases, strokes, dementia, cancer, right, the big 4, but metabolic dysfunction being, obesity / diabetes, which of these 5 devils, as you call them, are the most dangerous?
Oh, in America, obviously, the heart disease is the number 1 killer. Most of the heart disease is from the blockage of the arteries by cholesterol. In the old days, we thought when you have a normal, what we call bad cholesterol, LDL, you are safe. But it's a misconception. Different people need different healthy level of a bad cholesterol level. It means that when you have a quote-unquote normal cholesterol level, if you are in a high-risk group, that normal level is not a healthy level. You still can end up having a heart attack and heart problem. And the other new concept actually came out in the last decade. We find out that actually the obstruction of artery starts very, very early age.
Really?
So when a baby is born, the bad cholesterol, LDL, usually is around 10, the level, which is a very healthy level. But it can go up very fast. So there's a big study to dissect the children who died during the car accident to see whether they start building up plaque and a blockage in the arteries. They find that as young as 10 years old, some children has been developing blockage in the arteries already.
Wow.
That's
amazing, isn't it? That's so young.
Yes. So all along we thought, okay, when we see the blockage, we do something about it. But that is a wrong concept. You have to prevent it from developing. So what happened in the last 10 years, the cardiologists know that the number one risk factors for what we call cardiovascular disease is the bad cholesterol level, LDL level, times the period, the time zone, duration you have the abnormal cholesterol level. It means that the younger you have the abnormal level and the longer you have, the more likely you're going to develop a heart problem. So in order to prevent heart problem, we have to control the bad cholesterol as young as even 10 or 15 years old.
There's an enormous amount of education required here for our human beings so young.
Right.
At such an early age, you know.
Correct. Now, as I said, in American healthcare system, educational medical education, there's a wrong direction a few years back is that we are trained to treat diseases, but we are not trained to prevent diseases.
Mm-hmm.
But all along, the best doctor is the one to make sure you don't get the disease. It is better than some surgeon who can operate on a very complicated surgery. The best doctor is still the one who prevents you from any major diseases.
Well,
so
yeah, go on.
So in cardiology, we try now change it to emphasize on preventive cardiology. So that is probably the best way to save lives and also give you a better chance to have a longevity, a happy longevity.
Okay, so the book, in case you've just joined us, okay, I have Dr. Chand with me, Dr. P. Albert Chand, by the way, and his book is titled Everything About Happy Longevity, Evidence-Based Medicine, right? East meets West. Now, we've known for years, you know, there's an old saying, you don't see too many fat Chinamen, do you? But I mean, cultures in the East with food far different from the West. And you've learned the significance of Eastern medicine. I mean, you spent 15 years practicing in Asia. You gained the knowledge of Eastern methods combined with Western medicine practices. And this is what has facilitated your creation of a step-by-step formula for a healthy life, yes?
Correct. Now, even though I was trained in America, all my medical education I got it in the U.S. But in the book, I did mention I was somewhat fed up by the also HMO style of medical practice. So I exiled myself to Asia for 15 years to practice medicine over there. Mm-hmm. But during that period, I have a great opportunity to learn and understand the healthcare system, the style, and also what the advantages about the Eastern medicine. So I find out that we can learn from each other. Now, Western medicine, no question about it, is science-based, very advanced, especially technology-wise. Mm-hmm. But the disadvantage is they depend on a lot of high-tech and also pharmaceutical treatment. Mm-hmm. Mm-hmm. So, and then they don't put too much emphasis on the preventive medicine. Now, Eastern medicine is totally different. They are passed on generation by try and error kind of practice. Mm-hmm. So they learn from thousands of years of practicing medicine.
Yeah, well, that's it. Thousands of years, you know.
Right. But unfortunately, they are not evidence-based. So if you ask them to show me what the evidence you have, most of them just say, we learned it from the 1,000 years of experience. But that's not enough. You need evidence-based medicine. Mm-hmm. So they're changing. In the last few decades, some places like Singapore, Hong Kong, they're applying the Western scientific method, try to prove it. Mm-hmm. The traditional Chinese medicine has their value, and some of them is evidence-based. Now, the other thing I think good about our Eastern medicine is that they emphasize on yin and yang. So it means that the balance. that is something that is the core of the traditional Chinese medicine.
Mm-hmm.
In the end of that, what they emphasize is what we call inflammation, or is in Western medicine. Inflammation is a lot to do with our immune system. You have to be the right amount. It cannot be too much. It cannot be too little. So your immune system cannot be overreacted or underreacted. So traditional Chinese medicine emphasizes a lot on this, what we call the fire in your body,
right,
which is equivalent to inflammation. You got to balance it by doing different things. Exercise, diet, herbal medicine, even meditation. So to balance your immune system. So that one, if we can prove it evidence-based, using the modern science to prove it, they have their value. I think to integrate that traditional Chinese medicine from the East plus the Western medicine, I think it can benefit. It can get the benefit from both sides.
Well, that's what you say. I mean, many people take an Eastern or Western approach to medicine. A lot do. But what do you think about a combination of the two? Why don't more Americans do this then? I mean, because you're right about it. But what is it with, let's just talk about Americans. Is it because there's no 3,000-year history, or is it because they're not wise enough? What's the problem?
Now, the first thing is that they don't taught us in the medical school, because the medical school totally ignore Eastern medicine. They only emphasize on Western.
Is there a money reason for that, do you think? Is it the system? What is it?
Because they're trained by the people before the same way. So that you pass it on, they basically, now, one thing, the strong point about Western medicine is no question about, they're based on science. You have to prove me it works before I can use it, which is the strongest point about Western medicine. The Eastern medicine, now in the last, let's say, 1 or 2 decades, things are changing. Like Sloan Kettering, Memorial Sloan Kettering Cancer Institute, which is one of the best cancer institutes in the world. They are starting using what we call alternative medicine to help people how to cope with the cancer. So they how to control the pain without medication, how to build up your immune system by changing your diet or mild like exercise like Qigong and Tai Chi in Chinese traditional medicine. They integrate these kind of alternative medicine and put in some evidence-based medicine in there. They find out that actually extremely effective and has a benefit not just to make the patient better and even cut down on the pain and the suffering.
Well,
and not mention some of them even prolonging life.
We understand.
But it's a new thing. It's a new thing.
But, you were inspired to teach people about longevity. How does your career, though, as a cardiologist, inform your book?
Right. Now, as I said, all along, now, one of the major points give me an encouragement to write a book is when I became a patient myself. So as a typical doctor in America, we are so busy. We have no time to take care of ourselves. So we may exercise a little bit, keep an eye on the diet, and that's about it. We don't even do the checkup sometimes. So about more than a decade ago, I find out I, myself, as a cardiologist, have a heart problem. So I suddenly changed the totally how I look at medicine. Suddenly I look at it from a point of a patient, the point of view from a patient. So we look at it, I forget about the prevention. I should have prevent this kind of disease long time ago when I was young. So that is one of the main reasons why I wrote the book.
Well, okay, Dr. Chan, I want to break them down, if I may, the 5 Fs, as we talked about earlier.
Sure.
One at a time, slowly, on happy longevity. By the way, you're listening to Nothing Like a Good Book, and which can be heard on all your favorite podcasts across the country and on markbishopmedia.com. There's a photo there of Dr. Chan, also a bio as well. His brand new book, Everything About Happy Longevity, Evidence-Based Medicine, East meets West. Now let's take fitness as number one. You need the stamina to enjoy longevity. And you say especially a happy, healthy, and independent one. What do you mean by that?
Now, fitness, it means that you're able to do a lot of things independently. You have to have the stamina. You have to, let's say, even if you live until 100 years old, if you lie in the bed all day, that is not happy longevity. If you have a dementia, if you have a stroke, that is not happy longevity. So what I mean is that you have to do a lot of things to prepare for happy longevity or just longevity itself.
You've got to force yourself, right? Because as you get older, you know it's more difficult to push yourself.
Right. Now, let's say exercise is also the most important thing for fitness.
Exercise, okay.
So different kind of exercise should be emphasized at different age. So when you're young, you try to protect your heart and you try to build up your fitness. So you do a lot of cardio-metabolic type of exercise, running, jogging,
Right.
etc.
Right.
Then as you get older, you have to be careful about the muscles because you start losing muscles. You're going to have a joint disease. You're going to have a pain in the neck, in the knees. So you have to emphasize on exercise to avoid arthritis and build up your strength. As you get even older, you have to be careful not to fall because you can be absolutely healthy.
Oh, yeah.
One fall could deteriorate all your enjoyment. So what I say is that right, the fitness is you have to emphasize in different age.
Okay.
Now also that is what the fitness is about. Yeah.
Right. So one has to really think about their age group, what they can do sensibly, and go from there. Now, I understand about the muscles business because I was pretty ill this year with pneumonia twice in hospital, and I lost a lot of weight, but also I lost a lot of muscle sense as well, and trying to build up again is very difficult. But now let's talk about family and friends. Now, this is, what on earth has this got to do with it? Loneliness kills more people than most diseases. Losing a loved one will take many happy years from your life. How does one address this?
Right. Now, everyone knows that families is important. It's scientific proof that loneliness can cause a lot more death, not to mention it can aggravate the heart disease, can aggravate the dementia, and also can cause all the other metabolic diseases. So you got to have a family that you stay with. Now, they did a lot of study. If anybody lose their loved one, they lose so many years, okay? Family, if you don't have it, at least you should have a lot of close friends. Now, even for my book, is that if you don't really have these two Fs, but at least you should get a dog. So no question about spending time with your family can encourage a lot of happy longevity.
All right. Okay, that makes sense. I agree with that. There's a couple more. One is finance. One does need a stable financial condition to enjoy happy longevity. But you don't need a lot of money, right? But be content. Right. And you say be content and enjoy life. Yeah, well, go on. Explain that one.
Now, it's easy to say, okay, I can enjoy life without any money, which is almost impossible.
Tell me
you still have to make sure you don't have to worry about money every day and night to enjoy life. Not to mention, you can shorten your life from the stress and losing the sleep.
Stress.
So you don't have to be rich. You don't have to be rich as a Bill Gates. But at least you have to be stable. You have to be financially stable to how to enjoy life, how to maintain your longevity. So again, you probably don't need a lot of money. You can be of a lower middle class, but you still can enjoy happy longevity. But you are under the poverty, then it's very difficult to enjoy life. Yeah.
Fame is another F of the second last one. I don't mean one needs to be famous, but you do need to be proud of what you're doing. That makes sense, doesn't it? That's psychological.
Right. Now, when I say fame, I don't need you to be a movie star or some kind of a famous person. But you need to be proud of yourself. You have to have the self-respect and self-esteem. Even you're a janitor, you should be proud of what you contribute to the society and what you give the service to the world.
Hmm.
So you're proud of yourself. Now, if you lose your self-respect, that hurts your happiness, and that will hurt your longevity.
Yes, I can relate to that one. Now, the last but not least is fun. You say, don't worry, be happy. That reminds me of a song. Enjoy life now. You're saying live in the now.
Yeah, in psychology, there's a word they call anhedonic life. So a lot of people are afraid to enjoy life because they said, I need to save time, I need to save money for the retirement. I cannot just having fun so much time, spend too much time and money on the fun now. So we should save it all until I retire. But unfortunately, I heard so many sad stories. People save time and money. They work hard. They didn't spend any money. They don't enjoy life. When they retire, they die within 1 or 2 years.
And what is the main reason? There's all sorts of myths about this. Is it because they're not as active, or the mind isn't active, or there's no challenge, there's no hills to climb? What is it?
It's the fear and the stress. People always fear that they don't have enough money when they get old. People think that if I don't work hard, I'm not going to have money for my retirement. But they don't understand you don't really need a lot of money to have fun. So even watching a TV can be fun. Spending time with your family and the friends without any spending expensive meals or vacation, you still can have fun. The question about is that people always afraid that if I enjoy too much, I will have a hard time down the road. But they don't know that this is what we call anhedonic fear. So we do emphasize that you got to find some way to have fun now.
One way or another, even if you just play.
Because actually stress is one of the major factor affecting happy longevity.
Right. Now, we don't have a lot of time left, but I'd like to get a couple of these good questions out quickly if I can. I want to ask you, for instance, how has your heart condition played a part in your passion for happy longevity?
So what happened is that I was working in the overseas in Asia for a long time. So when I came back, I joined the faculty in one of the major medical schools in the U.S. So I have more time to think about my own health. I said I haven't had a checkup myself for a long, long time. So I decided to have a checkup from my colleagues. Then surprisingly, I find out I have a blockage, one of the major arteries in my heart. So I was totally surprised because I have no symptoms.
Whoa. Yeah.
Yeah. So then I find out the obstruction actually quite significant, 90%. So all the colleagues jumping on, okay, let's put a stent, put a balloon, blow it up, let's do all the major procedures. I said, wait. Heart disease, especially what we call cardiovascular disease, is a systemic disease. It's every arteries in your body start building blockage. You just open up one, it's like a whack-a-mole method. Okay, which one come out, a blocker, and then try to open it. But you don't solve the problem about the disease. Especially I have no symptoms. I have no chest pain, no shortness of breath, even when I have a high level of exercise.
Right.
So I put myself and said, let me apply science, evidence-based medicine.
Right.
So I decided to aggressively lower my bad cholesterol, exercise well, eat well, try to do a comprehensive treatment of therapy for myself. Then after about 10 years, I did the checkup again, do all studies again. It was even better than 10 years ago.
There you go. Everybody should do that. Tell me, what are the main focuses of primordial proactive preventive medicine, what they call PPPM?
Yeah, the first one is the primordial. You got to nip the things in the bud. You got to know what your risk is and try to treat it as early as possible. So I make a mistake. I waited for so long.
Right.
So I will try to tell the readers and all the patients, you got to start early. In order to start early, you need to know your risk. So your primordial is treat it early, prevent it from getting worse, or even prevent it from starting. Proactive is that nobody will tell you to do it. Because right now, the healthcare system, the doctors can only spend 5 minutes with you. He or she is not going to be one to tell you, now you need to do this, do that, how to do the checkup, etc. So proactive, you're on your own. Well, you have to do it yourself.
You got to do it yourself. Now, there's one I want to ask you, because there's a lot of people, a lot of guys, I know for a fact, friends of mine, what affects not getting enough adequate sleep, what effect that has on a happy longevity.
Right. Now, the sleep disorder in the last decade, it was found to be one of the major risk factors for all the 5 devils. It can cause heart disease, it can cause stroke, it can cause dementia, it can cause some of the cancers.
Good Lord.
And not to mention, also the metabolic disease, obesity, prediabetes, and diabetes. So in my book, I recommend, I promote sleepiness as a part of exercise.
Yeah, but what happens, Doc, I want to ask you this. What happens to the poor guys that have got to get up 2, 3, 4 times a night to go to the loo? You know what I mean? That's broken sleep, right?
Now, the sleep disorder now becomes a specialty in medicine. So they have a doctor trained to help you how to improve your sleeping pattern. Now, sleeping, interestingly, healthy sleeping is not just the number of hours you're sleeping. You have to achieve a certain of what we call a stage, the peaceful stage, to get the benefit. So just numbers of hours is important, but it's the quality of the sleeping is the most important one.
The quality, right. So, putting timers on that, I must get my 8 hours or 7 hours. That's a bit of a fallacy, right? The fact is you might only have 5, but it's the quality of those 5.
Right. Because you need to do what we call rapid eye movement stage to achieve what we call healthy sleeping period.
Okay.
So in order to do that, there's now totally a specialty. You have to try to decrease your stress. Don't exercise before you sleep. Cut down on caffeine before you go to sleep. How you get to sleep fast, and how to achieve the best stage of sleeping as fast as possible, as long as possible. So that is basically part of exercise nowadays.
Yeah.
You got to integrate that, right? And then it is extremely important because sleepiness, lack of sleep, actually can cause so many diseases that it should be one of the major specialty. Yeah.
Well, I tell you what, I'm looking forward to finishing the darn book because it's got a lot of good, helpful points in it. Last but not least, Dr. Chan, what is the sin versus joy effect on longevity?
The joy, I'm sorry, you say?
Well, what is the, you say sin versus joy. I mean, it seems to be logical, really, doesn't it?
Right.
It's what I think it is,
Right, yeah. Interesting. Now, I put it at the point like alcohol. Now, alcohol, now in the old days, we think alcohol is a very good drink for health. But now in the last 5 years, we find out that even 1 drop of alcohol can be harmful to you. You used to have what we call French paradox. People think drinking wine can help the heart. Now, in the last evidence, in the last 10 years, we find out it didn't help. Okay. Now, but on the other hand, funny thing, when you look at the people who live a long, long time around the world, a lot of them drink. They don't take supplement. They don't take some of them. They only have 3 same component. They still drink a little bit alcohol. Most of them, not everyone. They're happy and they are active.
Yes, I think those last 2, happy and active, and
So
if you can't have a nice glass of red, well,
So to go back there, I find out that actually alcohol can help in terms of the health, but not because of alcohol itself. It's the happiness itself.
It's the happiness.
Right, which is an article that says, now not to mention the last thing is that even exercise and diet. If you're forcing yourself to certain diet or certain exercise, but you don't enjoy it, you don't have happiness from that, you'll never gain any benefit from it. It won't last long.
Right.
So even the exercise and diet. So what it means that sin versus joy is that summertime you should allow yourself to eat a little bit meat, You can a little bit enjoy a little bit dessert. Exercise, you got to find something that not going to harm you, but it's still, you have to be, somehow you have to balance it. Happiness is still the key.
Well, Dr. Chan, time's up, but
Okay.
very interesting. But I recommend, folks, you've got to read this book. There's a lot more in it, and it makes a lot of sense. What I like about it, really, I mean, he uses simple language to cater to a wide audience with obscure medical terms so that you understand these terms. It is a straightforward read. It's even got clever illustrations and sensible explanations through it. And according to Dr. Chan, it consists of many simple guidelines to obtain a happy, healthy, long, and independent life, but with stamina. And that's what's important as well. And in fact, Catherine Picard, who's a library and book connoisseur, a comment from her: this is a top-notch book for all readers, but especially those who are needing an excellent blueprint for changing their lives, or for those who are curious as to how to help themselves obtain a healthy and long life. Because sometimes we don't know where to go. Doc, where can I buy the book? Where can my listeners buy the book?
Right now, it's only available on the Amazon.
Funny about that. Amazon.
Right.
I've never heard of them. Well, are you going to get number one in the medical field, do you think, or in the medical division?
Yeah, I hope. Like in Amazon, I only charge 99 cents for the e-booking.
That's
because
fantastic.
I want a lot more,
right.
But only 99 cents because I want more people able to read it. But if you can afford it, I do encourage you to buy the hard copy. So keep it, read it from cover to cover.
Yes.
And practice.
This will make a fabulous gift too. Fabulous gift for somebody you love. Achieving longevity without happiness is meaningless. Remember that. Dr. Albert Chan, medical doctor. His new book, it reveals secrets to living a long life in complete health. Thank you, Doctor. It's been
thank you for inviting me.
Very interesting, and I wish you well with this book because
Thanks.
At the end of the day, it's all about helping people. Thank you.
Thank you. Thank you.